Hello, folks. Hope you're doing all right.
I hope too.
Yeah, we hope you're doing well. Welcome to Stay Well with Dr. Zorba Pastor.
And that's me.
Here he is.
Bum.
Oh, he's going to sing, folks.
You're doing it too.
It's infectious.
Bum.
I'm Carl Christensen. I'm sitting across the desk from the one and only
be a
singing
duo.
Zorba Pastor.
The singing Zorba Pastor,
Yep.
That's right.
Who used to be a soprano back in high school.
High soprano.
That's right.
I mean, so high that it embarrassed me. And then puberty came in and my voice is still high.
Now you're,
I want to be a baritone.
You're a baritone.
No, I am not a baritone.
Sometimes you are. When I don't
You
know.
mean sometimes I get to
You
that,
get low
my
enough.
inner self?
It depends.
Maybe I can get to baritone. I don't know if I can
You can
down
get there,
That's
I feel
right.
like.
That's right. But I can get to a really high soprano.
You can definitely get up
Let me
high.
give the phone number.
Okay, yeah,
instead.
please do that. We have a show.
608-492-9292. I had to get that number from AT&T, and I love it. 608-492-9292. Easy to remember.
Easy
you
to
can
dial.
Email me. Easy to dial.
Yeah.
Nobody dials. But
No one
easy,
dials?
No, they punch. And you can email me at askdrzorba@gmail.com. And, of course, the website, drzorba.org. But you never actually dialed a phone number, did you? Did you ever
I had a
dial?
rotary phone when I was really young.
Really?
Yeah.
How young?
You know, like 5 or 6. I remember that thing.
You remember?
And my grandma had one.
Oh, you remember all that
Oh, yeah.
stuff. That's right.
My brother and I loved
That's
playing
right.
with that phone.
That's right. You're showing your age. You're no longer in
Every
your
day.
20s.
I know. Every
Every
I
day
show
in
my
every
age.
way.
Yep.
In every way.
We have a show. We have a show to get
Okay.
to. Today, we got a big show. Zorba's going to dissect a study that shows there's a new blood test that may or may not
That's
predict
right.
Alzheimer's.
That's right. We'll talk about that.
We'll talk.
Right.
We'll get to that. Zorba's going to answer a listener voicemail. We'll get to some listener emails. We're going to wade through some listener Facebook comments, which is always fun. Zorba loves posting a lot on Facebook, so it's good to hear some comments. And my mom's going to tee up one of her mom jokes.
Of course.
Ready to go.
Of
Teed up.
course. That's right. That's right.
All right, the phone number to call anytime, it's that one we just said, 608-492-9292.
That's right.
Call
That's
it
right.
anytime. If it's at night, we won't answer probably, but it is a hotline. We love getting phone calls. So
Hotline
please-
with a red phone, right? That
Yep,
was
the
that
bat
was
phone.
the hotline. That's right. That's right. When I first started medical practice with Dr. Keller and Dukersheim, there were 3 of us. We only had 2 phone lines.
Wow.
I mean, think about how different life was. We had 2 phone lines, and it wasn't that hard to get a call. They would call up, but we had 2 phone lines, and we had a back phone that nobody knew except for our spouses that we could call out on.
That was the
and
back
then
line, the
that
back
was the
phone.
back line. If there was an emergency, they would call on the back. There was no cell phones. There were no cell phones.
sure.
So we had 3 lines in the office, but the hotline was a red phone.
Oh, it was actually
physically red.
Those are cool.
Yes,
I can
on the
picture that
wall,
thing.
it was physically red. It was a wall phone,
Gray
physically
buttons,
red. That's
right?
right. Yeah,
Like red,
Yeah,
yeah.
physically red. Yeah,
Beautiful.
got it.
Okay, let's get into our healthy living topic. There is a new blood test that can predict when Alzheimer's symptoms might start.
Well, supposedly.
Perhaps.
So let's talk about this. First of all, let me give an overview of dementia, because that's really the issue, dementia and memory loss. So half of all dementia is Alzheimer's, probably Alzheimer's. And once again, it's a clinical diagnosis. You have multi-infarct dementia. Those are little strokes that occur in the brain. You have alcohol dementia. You have something called Lewy body dementia, which is associated with Parkinsonism. And then a smattering of other issues with dementia. And before we go into this study, because I think it's really important, I want to talk a little bit about the Framingham Heart Study. Now, I talk about Framingham all the time, working class suburb outside of Boston, more gentrified now, not quite as working class, in roughly its 40th year. So you have groups called epochs, EPOCH, and epochs are 10-year periods. So 1980 to 1990, 1990 to 2000, 2000 to 2010, 2010 to 2020. They take some of the data and they look in these 10-year periods. Once again, longitudinal study, and they want to look at the prevalence of dementia, once again, because all dementia is not Alzheimer's, and whether or not there's an increase or decrease. It turns out that over this 40-year period, there's actually been a 44% decrease in the prevalence of dementia Among these cohorts, the 2010 to 2020, in all groups but one, there's a 44% less dementia in all groups but one. People who did not complete their high school education.
Oh, that's interesting.
People who did not do their high school education and didn't get a GED, so they were high school dropouts, they have the same prevalence of dementia now as they did in 1980. So, first of all, we don't know exactly why, but some of it makes sense. They're more likely to smoke cigarettes. They're more likely not to have as much money, not to educate themselves. They may not be as likely to go and see their doctor because they haven't completed high school. They may not be as likely to look, hey, I should do this because I've read about it or heard about it to improve my health. There may be a whole bunch of things. It may have to do with smoking cigarettes. It may have to do with alcohol consumption. It probably has to do with a whole bunch of things.
Yeah, access to good medical care. That's probably a big part of that.
Big part of it.
Yeah.
So there's a very important takeaway here. Very important takeaway, I think, is that education is a key role in the reduction of dementia.
Okay.
That's the basis of this. The second key role is because many people are educated, get their blood pressure under control, and if they have cholesterol issues, they take a statin. They eat better, they exercise more, and they stop smoking cigarettes and drinking too much. And that reduces the risk that you're going to get small strokes. Remember, like I said, we can't really prove what's Alzheimer's, but we can prove what's dementia. So a lot of that reduction is from that. But the real question comes out, there was an article published in Nature's Medicine about basically a biomarker called Tau 217. Now, Tau 217 or 217 is a biomarker for amyloid deposits, which produce which is basically producing the plaques and tangles of Alzheimer's. So in Alzheimer's brain, if you look at it, sort of like a telephone system where the wires are all getting goofy.
Okay.
That's the theory behind it, because when we do an autopsy of a brain with Alzheimer's, that's what we see. And we know that amyloid, this protein that's deposited in there, is part of that. And the tau marker is showing that you may be at risk for Alzheimer's. So I think it's a reasonable marker, but it's you may be at risk for Alzheimer's. What are you going to do about it? So first of all, it's you may be. It's not yes to yes. It's not 1 to 1. And what are you going to do about it if you're at risk? Well, first of all, you're going to worry about it.
Sure.
Right?
Of course.
Biomarker positive. What's the false positive in the biomarker? In other words, where people don't get Alzheimer's and it says you're going to get Alzheimer's. That is yet to be explained to me from the data I've read. So in other words, some people say, hey, in 4 years you're going to get Alzheimer's. You freak out and all of a sudden it ruins your life because you're worried about it.
Right.
There's side effects of false positive tests that can't be
psychological effects.
Psychological.
Right? Yeah.
Then let's look at what you can do for the plaques and tangles. Nothing. There's no drug that really does anything for pure Alzheimer's. What you can do to reduce dementia is get your blood pressure to 130/80 or lower. May mean taking 2 or 3 blood pressure pills. Stop smoking, stop drinking too much, exercise every day, plentiful fruits and vegetables. Whatever you do for health for your heart is going to reduce the risk of dementia in your brain. So that's one of the things you can do. So you don't really need to have this test in order to show that. And the false positive is really a side effect from the test. But the other thing is lifelong learning. The brain is like a muscle. And here's where something called the nun study comes in that's very important. So there were a bunch of nuns in Milwaukee, and there was a researcher in Kentucky. I have no idea how the connection came. And all of the nuns said when they die, they will give their brain to autopsy. Okay. 100% of the nuns. They all signed into it. And the nuns, as they got older and older, started dying off. A number of the nuns showed symptoms of memory loss, like Alzheimer's or dementia. Other nuns did not. They discovered a few things. Number one, the nuns who engaged in more intellectual work in the nunnery, like the accountants, people taking numbers, the plumbers, the people who were fixing plumbing because they did a bunch of things, the people who actually worked with their brains and their mind had less Alzheimer's than the people who did not. You'll say the people who did basically the janitorial work. That wasn't the only surprising thing. The other surprising thing was the people who did not show signs of memory loss, a number of them, when they did the autopsy, had the plaques and tangles of Alzheimer's.
Oh, interesting.
But they didn't show it. So in other words, just because you are going to get the amyloid protein in your brain, just because you have tau marker 217 that shows you may get amyloid in the brain, doesn't mean you're actually going to show signs of dementia, because people who often are more educated, doesn't mean everything, and take care of their cardiovascular health do not show as many signs of dementia, even if they have the plaques and tangles of Alzheimer's. So I am not, at this moment, pro to anyone getting the Ti 217 biomarker, because it may freak you out for no good reason.
That's really interesting research. 608-492-9292. That's the hotline. You can call anytime if you have a question for Dr. Zorba.
And don't forget, you can email me at askdrzorba@gmail.com or go to our website, drzorba.org. You'll see pictures of Carl, pictures of me, and lots of good information.
Lots of good stuff there. Let's go to the phones. Actually, this is a voicemail. A listener called that number and left us a voicemail. And Zorba's going to address it right now. This is a listener from New Jersey.
Hi, Dr. Zorba. I'm originally a Wisconsinite, now in New Jersey. And I have a question for you. Your thoughts on use of low-dose radiation for treatment of joint osteoarthritis. Thank you so much. I enjoy your show immensely. Bye-bye.
Well, radiation has side effects, right? First
sure.
of all, we know that. The younger you are, the worse it is, because you have a body that may then develop cancer later on from the radiation. Now, in other words, we know that radiation can cause cancer. Small doses of radiation are less likely than large doses, but we think about that with CAT scans and other things. We used to give radiation to children to treat serious acne. They were called...
How long? What year was this? When did this happen?
1970s.
Oh, really? Okay. I was going to guess like the 50s or something.
1970s,
Okay.
I don't know if it continued in 1980s, but it actually was very good for acne, but it caused thyroid cancer. So great for acne. You're smiling now.
Better,
I mean, who knew?
Better to look good than to feel good. Isn't that what they say?
Yeah, look good. So it causes that. I don't know much about this radiation for joints, but I'm always afraid of radiation. So I think I would be wary. It's something I would not recommend. Certainly, there are things that you can do for your joints, lots of things. Exercise, you can take anti-inflammatory joints. You can have ultrasound, which is not radiation at all. They're basically sound waves. Sometimes they help the joints. But it's not something that I would support as something good for good health. Because first of all, I don't know if it's going to work. Nobody's going to actually do it and do a double-blind study because of the potential side effects that radiation is bad and has the risk of cancers. So my answer to this is no.
All right, Zorba. Let's take a listener email. Were you expecting something different? That was kind of a long pause, I guess. No, it's just an email. That's all. This is from...
The pause that refreshes. That was a Coca-Cola commercial, by the way.
Oh, really?
Did you know that?
No.
The pause that refreshes.
Pause?
That's probably when we weren't trying to do everything all at one time like we are in our society.
Yeah.
When I was a kid, the pause that refreshes. Take a pause, drink a Coke. Yeah, that's what it was. You never heard that?
No,
Yeah,
I
pause
haven't.
that refreshes.
I've heard that it's healthy, though, to just kind of stop your work for 5 minutes and just do nothing.
And drink a Coke?
Not the Coke part.
Okay,
No,
not
just
the Coke
stopping,
part.
and just...
Yeah.
We maybe on a future podcast we'll cover that,
Yeah.
whatever that study
No, maybe
was.
we should pause
Just
for 5 minutes, but then nobody
dead
would
air?
listen.
Yeah, right.
Dead air for 5 minutes.
Here we go.
That's a radio thing. Nobody
Yeah.
else knows about dead air. Yeah.
I'll put like cricket sounds for 5 minutes.
Crickets sound 5
Yeah,
minutes.
People will love
Cricket.
that.
Yeah, put
Our
them,
ratings will go
put
through
me
the
to
roof.
sleep.
Yeah.
Our ratings will go through the roof, and we would be causing tinnitus.
Yeah. All right. This is an emailer who writes, "Dear Dr. Zorba, I'm a 68-year-old female, 5'9", 172, and in very good health. I'm currently on no prescribed medicine.
Mm-hmm.
However, I do take a teaspoon of children's liquid Benadryl every other night to help me sleep.
Sure.
And helps with my morning cough. I'm noticing my hearing and vision are changing. Could this be a result of the children's Benadryl or just my aging process? Many thanks for your sweet attention."
Oh, how nice.
That's kind of nice
How
ending.
I really like that.
Yeah.
Well, it's not from the Benadryl.
not.
Benadryl is an antihistamine. It's been around a long time. We know that the older you get, your eyes change quite a
Right.
bit. And they change in a stepwise fashion. So sometimes people's eyesight will be perfect, and then they may see the optometrist or ophthalmologist every 6 months or every year for a follow-up, and their glass prescription may change over the next 6 months, 1 year, or 2 years. And then it stops and it stays stable. So this is an age-related issue. Benadryl, well, let's talk about that. It's an antihistamine, basically. A children's Benadryl is going to be the same as adult. It's usually in a 12.5 milligram dose, which is half of a typical Benadryl tablet. Is usually over the counter is 25 milligrams. So it's a small dose. There's a list called the Beers list, Beers, and it's a guy, I can't remember, a doctor who made up a list of drugs that can potentially cause issues. So antihistamines, which are over-the-counter sleeping pills that can make you sleepy, potentially run a risk of dizziness when you get up during the night or dizziness in the morning. And so although a lot of people use it, the question is, how safe are they? So if I recommend people take it, which people do on a regular basis, I say the most important thing is when you're getting up during the night, if you're getting up because Mother Nature calls, which is a good way of saying you have to get up and pee.
Yeah.
Sorry, Mom. I said the word pee.
Oh, she didn't like that word?
Oh, I don't know. My mother, she was brought up in an English household. They never said what they thought.
Right.
They always said something else. Instead of my mother saying somebody was full of beep
right.
and make beep, but she would say they're full of hops.
Hops?
That's
As
right.
in like beer hops?
Well, I thought as a kid she meant that they were funny. They were hopping around.
Like a little bunny.
Yeah, bunny. But no, full of hops.
Interesting.
Meant because she didn't say, can you beep this if I say it? Of course, we're podcasting.
Yeah.
She wanted to say they're full of She couldn't
Right.
say that.
I'll beep that.
Because she would you'll
Or
beep
not.
that.
Or not. Who knows?
Yeah, I do want her there. But getting back to the Benadryl issue. If you're going to take it, when Mother Nature calls, or when you get up in the morning, sit on the side of the bed.
Okay.
30 seconds.
Take a beat.
Take a beat. That's right. Before you get up and you reduce the risk of falling. There's something else that is also very interesting. When people are older, like their sense of smell, their sense of hearing tends to go. Their sense of thirst often goes also. So often at nighttime, people can be dehydrated and they don't realize that. And some falls are thought to be secondary to dehydration that occurs during the evening. You don't want to drink a lot before you go to sleep because basically, you're going to have to get up and Mother Nature may call you more than once. But in the middle of the night, if you're getting up, have some water on the side of the bed. And if you're getting up in the middle of the night when Mother Nature calls, go back to your bed. You've got water there and drink half a glass of water to keep yourself hydrated. So when you get up in the morning, you are less likely to fall. And that may obviate some of the side effects of over-the-counter sleeping pills that contain Benadryl or doxylamine, which is another antihistamine that make you sleepy.
All right, Zorba.
Wait a minute. Should have been that makes you sleepy or that. Let's go to the grammar for a second because the grammar police are going to chime in. I said Benadryl or doxylamine or any other antihistamine that makes you sleepy. I don't know if I said.
Yeah,
I don't
think
know
you're
if I
covered
said,
either way.
Well,
now.
if it's plural, antihistamines that make you sleepy. If it's singular, antihistamine that makes you sleepy.
Right.
So it's really a function of where the S is.
Right.
So I think it's more the spelling police than
Maybe.
the grammar. Where are the grammar police?
I don't know.
Where are the
I'm looking
cops?
around.
Where are the grammar
Grammar
cops?
cops,
I haven't
not the
heard them
police,
for a
remember?
while. Where are they?
Well, maybe they'll chime in on that one. It's kind of like Surgeon General. They say Surgeons General.
Is that what they say?
Yeah, Surgeons General.
Oh, Surgeons General. That's right.
Not Surgeon Generals.
Yeah. Unless it's like, but what about if it's if it's a TV show, one of those soap operas? Is it General Hospital? Yeah, General Hospital, General Surgeon.
Not General's Hospital.
I don't know. I don't know what they say. Let's get on with
What
the
if
next
it's the
thing.
dollar, like the dollar store called Dollar General? Have you ever seen that one?
Yeah, of course.
If you're
Dollar
talking
General,
about plural.
Dollar General, Family Dollar, of course. Yeah,
Is
of
it
course.
Dollars General?
Dollars General or Dollar Generals.
Like you own a whole chain of them? We're way off track here. Let's do, where are we? Oh, we're going to talk about mom jokes.
Yes.
That's what we're going to do.
Correct.
We're going to do a mom joke.
Here we
And
go.
How do we just no set up and just hit it? All
We
right,
did.
this is
We
my
set
mom.
up jokes because we've been discussing Dollars General or Dollar Generals. Go for it.
A lot of time these setups are longer than the joke.
Let's get the music.
And it's
Go ahead.
I think we're already
It's
there.
okay. We're there. Let's get the music.
Here's a joke from my mom.
Go, Mom.
Mom jokes.
Hey, Carl, what do you do if you're addicted to seaweed? Seek help.
Ah, that's good. I like that.
I like
one.
that she addressed
That's
me
one of
on
the
that
better
one.
ones. I like that. Seek help.
help.
You know something? That's one of her better mom jokes.
Oh, nice.
That
I'm
should
gonna
be the
tell her
front
that.
one on the book.
Okay.
That
When
should
she puts
be
out
when
her
you
mom
open
joke
up the book.
that
Mom
kicks
joke
it
book.
off.
She's got it. That's
her opener.
exactly what it is.
I
That's
like
her
that.
opener.
Good job, Sandy Christensen. You nailed that one. Let's do a listener email now. And if you have a question, you can email askdrzorba@gmail.com. Zorba loves getting emails.
I do.
This is from a Wisconsin listener. Hi, Dr. Zorba. Thanks so much. I'm so glad you are continuing your work with the podcast. I loved you on public radio. I'm a healthy 71-year-old woman who's been having inconsistent bowel leakage for a few years. Mm-hmm. It's just periodic small amounts, usually throughout the morning, even after I've had a good bowel movement. I take Metamucil each morning to keep the movements firm.
Sure.
I haven't been able to correlate the leakage to my diet. I eat pretty healthy and low fat in general, or the fluid intake. I've had a colonoscopy with no issues noted. My doctor wasn't very helpful, said it was part of aging, so there was no further action. What do you recommend to take care of this embarrassing issue?
Well, the first step that you have to look at, and this is very important before you look at it, is whether or not you're suffering from constipation. Okay, that's step number one. She's taking Metamucil, but I doubt if she has constipation that's impacting. In other words, an impaction, not impacting, but impaction. We've got hard stool in there, and then diarrhea, or goes around that stool. It doesn't sound like that's the issue, but for some people, that is the issue. Lifestyle modification include toileting, going to the toilet on a regular basis, going maybe not once, but twice or even 3 times in the morning. So you get up and you have either a cup of coffee or 2 cups, or you have hot water, because it doesn't have to be coffee. You have your Metamucil or supplementation, that you're going to have for that. You then go to the toilet, and then an hour later, whether you feel like you want to go to the toilet or not, you then empty it again. In other words, because it may be that her rectum is not continuously emptying everything in the rectum, and that's what's continuing to go on. Now, the issue has to do with the sphincter, the anus. Now, we don't give the anus a lot of credit. Do you ever think of your anus?
Not a whole lot.
No, not a whole lot, unless you're sick, right?
Well, sure, yeah.
Now, think about it. Your anus can separate solid from liquid, except when you're sick, sometimes for 85 to 95 to 100 years, and you never even saw it.
So the anus doesn't get enough credit.
Doesn't get enough credit. I mean, you go to the dentist at one side of your alimentary tract, you make sure you get your teeth cleaned and everything, but we never actually think about the anus, which is, and also, I mean, I'm making a joke about the anus because there's so many jokes on Seinfeld and others.
Sure.
You're already thinking of a joke.
No,
Did you come
I'm
up
trying
with it?
not to.
Yes, you are.
No.
Go ahead. Come on. You can come up with it. I bet you can.
No,
I bet you can. It's too
This
it's
is a
too
serious
awful.
email, so no,
It's serious
I won't
email.
do it.
You're not gonna
Usually
do it.
I don't
You've
turn
got
this
one in your
down.
brain. You've got one in your brain, but you're not going to do it. But lifestyle modification in this case will make a difference. So my recommendation is you get up in the morning. You do whatever you're going to do in the morning, brush your teeth, whatever is going. You have your coffee in the morning. You have your psyllium in the morning, Metamucil. You have your bowel movement in the morning. And then probably a half an hour or an hour later, you have 1 or 2 other bowel movements. I think she has it is similar to anyone who has irritable bowel syndrome.
Okay.
So irritable bowel syndrome, which you don't really understand, is basically where you have bloating, discomfort, and a lot of people with irritable bowel syndrome also have some diarrhea. So there's some drugs out there which I don't recommend, but I would just recommend lifestyle modifications. And there's a very good chance that this can really make a difference for her. Just Coffee Cooperative is a worker-owned, fair trade, and organic coffee roasting cooperative in Madison, Wisconsin, dedicated to a model of commerce based on transparency, respect for labor, and environmental sustainability.
That's right, Zorba, and we both love their coffee, and we drink it all the time.
Absolutely.
One ingredient, no flavors, no additives, just coffee.
Use code ZORBA10 for 10% off your entire order on their website, www.justcoffee.coop. Just Coffee Cooperative, justice from the grounds up.
Okay, Zorba. You post all the time on the Stay Well with Dr. Zorba Pastor Facebook page,
I
right?
do.
You love
I do.
posting. You post
I do.
photos from your favorite travels, photos from your childhood.
I get lots of comments.
A lot of
I mean,
food
I don't read the
pics,
comments.
horses.
I get lots of horses. Yeah. I'm becoming a cowboy.
You are.
I am. I'm learning to be a cowboy. I got the hat.
Yeah.
I got the boots. I'm learning to ride
all
the
you need,
horse.
right?
Yeah. And my teacher today, when I took my lesson, I had a wonderful time. I started laughing. I wasn't scared at all. And she said, "Yeah, you're educable." So
Okay,
that was,
nice. You're right.
I thought that was a good sign.
Okay, back to this whole setup here. Recently, you posted a photo of you and your e-bike.
Yes.
You
I
wrote,
did.
and here's what you
Right.
wrote for the caption. Yesterday was a splendid 55 degrees, a splendid e-bike day for sure. Since I tossed my, quote, traditional bike for an e-bike, I have clocked more miles than I ever have.
Yeah, for sure.
Yeah.
That's right. Yeah.
You've been
I love my
e-biking.
e-bike.
You've been
I
e-biking
love
a
it.
lot.
I love it. I love
Yeah.
it because I don't care about the hills.
Yeah.
I mean, so I'll go much farther. If there's a hill and it's rising, first of all, it is exercise.
Sure.
People who ride traditional bikes sort of frown at you.
They look down on
you
the
know, well,
e-bike.
first of all, they're wearing spandex. I'm not wearing
We're
spandex.
making a lot of
They're
generalizations
making-
here, folks. Just to let you
some
know.
of them are wearing spandex, but they're all thinking
Silly
of-
suits. That's
there's
what my
some of
wife
them-
calls them.
Silly
Silly suits.
suits.
Yeah.
Well, some of them are thinking of spandex. But anyway, they look down on you like, "Hey, man, you're not grunting going up the hill." Well, I wouldn't go up the hill. So the answer is, for me, it gets me out. I love it. I can clock 20 miles.
Yeah.
And because I like doing it, I can go faster. Yeah, okay.
Yeah, it's good
Is this
for
a
you.
comment?
No, there's just we got a bunch of comments
Oh, okay.
from people.
Yeah, I loved
it
it.
struck a nerve,
Yeah.
which is great
Yeah.
because people love e-bikes and they like to comment about it. So I'll read a couple. Kate in Manzanita, Oregon wrote, "That's the same bike I have, or
wow.
very close. Honestly," she says, "it's too powerful for me."
Well,
is it a
can
pretty
be.
powerful
Well,
bike?
it's a powerful bike, yeah, but you scale it down. It goes from like 1 to 5 or
Okay.
1 to 6. And I'm often
You can put a
at-
governor on it or something.
No, it's got a button.
Oh, okay.
You push a button. So when I'm going up a hill, I move it to 3 or 4, depending on, on what the angle of the hill is. But then I go down to 1.
Okay.
Sometimes I do 0. Then it's like a regular bike, but it's heavier.
Right.
But 1, yeah, it's too powerful if you do that. And it's got a little throttle on it. So
sure.
if you're not careful with the throttle, the bike will get away from you. And I've had that issue.
Oh, really? Okay.
Yeah, 100%.
You gotta be careful of that.
You've got to be careful where you put your hand on the throttle, because
Okay.
I've done that twice in the last, once every year. I just forget to put my hand. You got to be careful.
Gotta be careful. I feel like there's a
Like
joke.
a horse.
There's a joke
Like
in
a
there
horse.
somewhere. I
A
feel like.
bike is like a horse.
There you go. It's got horsepower, doesn't it?
It does.
Do they?
It's your
they
mom.
have
That's your mom
horsepower?
talking.
Sorry.
It's your mom
this is
talking.
more comments. Jessica.
Your mom would be really happy with that.
Jessica asked, "I'm curious which one you have. We are looking into one now. Do you remember which one that is?"
Yeah, I have a rad bike, and the
RAD?
rad bike, the RAD, but the rad bike had some issues with some of their batteries.
Oh.
Recalled. My battery has not been recalled, but I like it because it's a nice clunky bike, so I'm very happy with it.
Okay. And we're not getting any money for that.
No, we're not getting
Just by
money
the
from
way,
the rad bike
From
people.
the
no,
rad,
not
from
at all.
big,
Yeah,
big
but
bike.
I looked around for bikes and wanted a bike that had bigger wheels, one that I found that I liked, had a step through, there used to be male and female bikes. Now a step through. I like this bike. It was recommended. I like it. I would get a nice clunky bike. I would then, if you're looking for a bike, I definitely would go to several places. I would look on a number of things like Consumer Reports and what bikes, and I would ask people who bike
Yeah.
what they think really works.
That makes sense. Yep.
Yeah, 100%.
Cheryl in Monona, Wisconsin wrote, "I was out with my e-trike just yesterday."
Oh, wow.
Have you ever ridden an e-trike?
No, I haven't ridden it, but I've seen those.
I've seen those, too.
Yeah,
I've
they're
never been on
trikes.
one of
They're
those.
e-trikes. They're great.
Those
Yeah,
are cool.
Yeah. You got to be careful with them going over
They're
certain
kind of
bumps.
tippy, right? Maybe.
Well, if you
or
go
not?
over bumps, you got to watch where you're going. But hey, on a bike, you got to watch where you're going anywhere.
Right.
There are things, I don't know if you've ever noticed on the street, called potholes.
Oh, sure.
And if you're on a bike, the pothole means more than it does than if you're in a car.
Finally, Laura in Kansas said, "Zorba, you inspire me to do more, travel more, and just living a good, healthy life."
Oh, how wonderful.
It's a good way to sum that
How
up,
wonderful.
Laura.
Excellent. Thank you
nice.
so much.
Yeah.
Thank you
So go
much.
to our Facebook page and look at all the photos, comment, and we might read one.
That's right. It's at drzorba.org, our Facebook page. Remember, ask Dr. Zorba at gmail.com. And our phone number is 608-492-9292.
All right, we had a big show today. I'm
We
going to try
did.
to sum it up. You talked about a blood test that may predict Alzheimer's, but you said, let's wait on it.
That's right.
Not
The false
quite there
positive
yet.
rate might be too high. It might make you anxious, and you might never get Alzheimer's. So I am not pro this test right now. Not pro at all.
Okay, we talked to a caller, or you heard actually a voicemail. You helped out a caller with radiation for joint pain. We talked about Benadryl, heard a mom joke, talked about IBS, and we talked about e-bikes. We covered a lot.
We covered a lot
It's a
of
big-
the show. And
big
we
show.
love doing this. We love doing this. Remember, again, the phone number, 608-492-9292. We love to talk to you. We love people who leave messages. You can call it up and leave a message. And as for emails, I love answering them. Ask Dr. Zorba at gmail.com. Spell it out, ask Dr. Zorba at gmail.com. And the website, drzorba.org. And don't forget to stay well.